Hey, Jen.
Hi.
So Nadia and I, this is like the first time that we've done a podcast sitting in the same room.
Yeah.
So that's kind of exciting
Oh,
for
cool.
us. Yeah.
Awesome.
Yeah. 'Cause she's home for the holidays and she's typically recording from Boston. So you get to be the first guest where we're together.
Thank you. It's fun seeing you sitting side by side. It's super cute.
Well, I'm going to do a brief introduction. I'm really excited to introduce Dr. Jennifer Kinder. She has a diverse work experience in the field of physical therapy and education. I've known her for a really long time, so I'm hoping it's okay that I refer to her as Jen. She is an associate professor at the University of California, San Francisco, where we both went to school for physical therapy. She owns and works as a physical therapy consultant at Rehab Fitness and Wellness, and she is the chief pelvic health physical therapy advisor at Blue Jay Health. She's passionate about helping patients with pelvic health conditions such as incontinence, pelvic pain, prolapse, pregnancy-related pain, postpartum recovery, and conditions related to menopausal or postmenopausal health. So I'm going to just go ahead and start with passing the mic over to Nadia. She has a lot of questions for you. And we did have a conversation about a couple weeks ago about pelvic health, just she and I. So these questions stem from that conversation.
Thank you so much for coming today.
Thank you so much for having me.
Can you tell us a little bit about how you decided to become a physical therapist who specializes in women's health and pelvic health?
Yeah. So like many PTs, I started out in orthopedics, and it was kind of funny. When I was working orthopedics, I was kind of always sent the perinatal population, I think because I was a female and and just could relate. And even though I had not had kids at that time, and so I was really working with a lot of the perinatal population. And then when I had kids, then I realized giving these mamas like 45-minute home exercise programs isn't going to cut it. And so then I had to wow. And I also had a challenging birth experience. And I was just horrified, literally horrified by the lack of care out there. And I was like, I'm a physical therapist and I know something about this and like, what is going on for all the other mamas in the world? So it just really set me off on a mission because, it just was really maddening. And as I've, really done my own like self work in the last few years, I've realized that, I think subconsciously I was drawn to pelvic health earlier and just from my own experience as a female athlete and things that happen in our life. And so I'm just really excited to be doing this work.
Yeah, it's really great when your work can be inspired by your own personal connection with a topic. And also, I don't know, I find it really great when you're trying to fix something that you think is broken. I don't know.
Yes.
That really helps me fuel a lot of what I do. So I think it's really cool. What sports did you play?
I played soccer like my whole life. And then I was a cross country runner and track runner in high school and college. And so, lots of running, 75-mile weeks training in college. I remember one time, it's so funny. We used to train 2 times a day and really early in the morning. And as a college student, Nadia, like, waking up at like 5 a.m. and going for your first run of the day, I literally stepped out the door. I was mid-run with my group and I was like, something doesn't feel right. And I looked down, I had 2 different shoes on because we had 2 different pairs. I literally had like the right shoe from one brand, the left shoe from the other. I was like, oh my gosh. So I feel for all of the college athletes out there because it's a brutal lifestyle, but also so awesome. So
yeah.
Did you feel like a lot of people associate like going out at night and partying with college. Did you feel like you could do that if you had to wake up at 5 a.m?
Yeah. So I definitely have always, and I think it's kind of rare, I don't know, but I've always been someone who needs sleep. Like I only pulled one overnighter my entire college life. And that was when I was studying abroad. And it was in Spain, and it was like, I was thrown into this like horrendous class. And it was like the only time I ever did that. I wasn't actually training at that time because I was studying abroad, But no, I actually went to bed at like, you ask all my friends, like they'd laugh. I would go to bed, I would do my work, my studying, I would go to bed because I knew I had to wake up. But then, study hard, party hard was kind of the motto. So, when I had my time, I like, for me, actually having sports in throughout my whole life kind of helped me organize my life. It's like I knew I had this much time to study and I would just buckle down and like hammer through. And so for me, like I loved it, and I got to meet different people, and it just was like broadened my life, and I love sports, and it's a big part of my life. So I loved having that.
Yeah.
You can do it.
I agree with like the organizing part. I feel like even in high school too, gymnastics really helped me because I had practices at certain times, like every single day. So I knew
that.
in like, I knew in
Gnarly
like certain
schedule.
moments, I knew in certain moments in the night, like I really need to get work done. But about a month ago, we talked a little bit about leaking while doing gymnastics. How common is it for young adults and young women who haven't been pregnant to leak when they run and jump?
Yeah, sadly, as I'm sure you both know, it's very common and really high in high impact sports populations. So jumping and running and this weightlifting, whenever the intra-abdominal pressure control of your canister, your trunk, is challenged by reaching that threshold of your pelvic floor. And if that, I think we're kind of jumping into other stuff. Sorry, let me answer your question, but then going a little further. I hope that's okay. But with those certain sports, like trampoline is a big one, making sure that the pelvic floor is conditioned for that. And maybe we'll get to this later, but like your pelvic floor is a skeletal muscle, so it has endurance fibers and fast twitch fibers. And another big thing is that neuromuscular control. So just, you may be strong in a certain position, but then weaker in others. And so for those dynamic sports like gymnastics and running and basketball and volleyball and have high pressure, there's just not enough done. And you look at the studies and it's like, there's no randomized controlled trials for stress urinary incontinence in female athletes like this. And I'm working on that. But, and so that's pretty maddening because it's one of the number one things why females leave their sport. And when we think about how that affects their long-term health as older women, like cardiovascular disease, osteoporosis, that's a huge problem for our healthcare system. And so that's, unfortunately, it's too high. We're going to fix that, right, Alyssa?
Right. Actually, okay, so it's true. Someone who might be leaking when they're running and jumping and tumbling, especially if they're wearing a leotard and they're fully exposed to everybody in their sport, they might like feel burdened by this leaking and then decide, like you said, to stop the sport. But I know personally, because I work with a lot of athletes, that there are a lot of athletes out there that continue with the sport and they find a way to manage. Now, if you're an athlete out there, you know that you find a way to manage. You've sprained your ankle, so now you wear like an ankle brace. Your back hurts every time you do your sport, but you've decided like, okay, if I ice every night or if I take ibuprofen every night, I'll be able to manage it. You find a way to manage it. And so there are ways that people manage leaking in sport, like, okay, fine, I'm going to leak. So in order to not be embarrassed, I'm going to go ahead and wear a pad. Or I know that might be confusing to people, but you can wear a tampon, and the tampon obviously isn't inserted into a place where urine comes out, but the tampon acts as a pressure against your pelvic floor so that you're less likely to leak. Some people will wear tampons, they will wear pads. And I'm just wondering, in your opinion or in your, with your scientific and medical knowledge, is it bad to use a crutch like a pad or a tampon to be able to tolerate your sport, knowing that it's a way to help you stop leaking and you want to stay in your sport?
Yeah, so great question. And I think this also goes for mamas out there who have prolapse, because it's like basically a very similar thing, is where it's like a tampon, like you said, it's being inserted in the vaginal canal and it's helping to hold the organs in place, the bladder, the rectum, the uterus. And so this tampon for our female athletes that, you know, I want people to continue their sport. The last thing I want is for them to have to leave it. That is not what we want. The thing is that we have to rehab as well as have the brace, because just like any brace, that brace is going to break down. And if you're dealing with ligamentous support that has been weakened and dealing with a weakened pelvic floor that actually helps support your ligaments and your fascia that's holding your urethra in place, right, and the bladder in place, then you got to work on that as well as use that brace to help get you through. So, you know, and we're following it closely every time to say, like, is this still working? Because the last thing I want, though, I don't want you getting worse, right? And so sometimes I think we kind of think all or none, and there is a middle ground. And I know that some coaches don't believe in the middle ground. However, it's important that they do if they really want, you know, the best performance out of you for the long term. And I know what you're going to say is like, sometimes they don't care, but you know, that's where the system has to change. And, you know, it's not going to change if we just keep letting it go. Like that's a guarantee. And I truly believe in that there are people out there like coaches that care for this sport and want to see it change. I mean, if we even look at like football, it's changing. We never thought that they would. Take a look at their concussion rates, take a look at their helmets that they're changing. We can change these systemic issues in female athletics because it really needs to. It's causing a very bad problem, as you know.
I love the passion. I love the passion.
Sorry.
Let's back it up a little bit. Let's back it up off the passion for a second. And back, as you're talking, I was realizing that we might not, I don't know if we talked about it in our episode.
Yeah.
Why do people leak? Like most people think that people leak because they're not potty trained, or like, you know what I mean? Like why, what makes people leak? Is it, you know,
Yeah. So leaking, we call it incontinence. There's different kinds. So stress urinary incontinence is the most, the one you hear about a lot, of like leaking urine or feces when you cough, sneeze, laugh, or do your exercise, like a tumbling, and you leak, right? So what causes it? Well, intra-abdominal pressure control. So we have if you think of your trunk like a canister, like a can of soda pop, right? And you've got the top being the diaphragm, the bottom being the pelvic floor. And then you have your transversus abdominis muscle running across your belly button. So horizontally, like if you look up the definition of the action of transversus abdominis, it's to hold the organs to the body. And then you have multifidi, and we even go as far as the glottis. So in the voice, the larynx area. So what's causing the leakage is, sadly, over time, so ideally what's supposed to happen is, you know, Julie Wiebe she created this great analogy to this as a piston effect, that as you inhale, your diaphragm should naturally descend, and your pelvic floor should naturally descend with it. And then on exhale, everything should go back to a resting position. What happens is sometimes people start holding their breath. You know, breathing abnormally in a way, sucking in their stomach, because we've learned to never let your stomach hang out in the society. And so then what happens is that piston effect is altered, and now you have a changing position of your pelvic floor. This can also be altered by your posture changes. So a big one is people like walk around in a posterior pelvic tilt, like tucking your tail between your legs because they learned it somewhere along the line. That's okay to do with certain exercises, but not to walk around daily, because it actually takes your lumbar curve out, and that changes the position of your pelvic floor. So when you have your breathing and then you put on top of that high impact exercise, the pelvic floor isn't getting the right excursion, and it starts to change things. And that's where you start to see the leaking happen. You can also have urge incontinence, and this is where things get super interesting, right? So you can have like the key in the door is what they call it. So some people will pull up to their house or, go to class or something, and they like turn on the shower and they instantly leak. That's more of a brain body connection. So we call it mind over bladder training, and even have it like people going to the bathroom like 6 times a night. I've even had a patient who was 32 times a day going to the bathroom. And so a lot of that was this urge that they felt. And we had to retrain the brain and retrain the bladder to know what is normal and help the body get a normal response to urge. So, and then there's mixed. Then you got both the stress and the urge, and then increased frequency. So lots of different kinds of incontinence, and very individualized to treat it too. So,
Yeah.
Thank you.
Yeah. Go ahead. Add to it, Alyssa.
Yeah, that's like a whole like quarter of PT school right there.
I know, right?
So hopefully people got that. But yeah, basically, you know, all that Jen said, plus the fact that, like, what the missing thing that people might not understand, like, okay, you have this pressure in your trunk, in your abdomen, and then your pelvic floor can't manage the pressure that's coming up on top, and then you leak. Why do we leak? Because the pelvic floor isn't able to support the contents that are falling down into it. Yeah? Did I get that right?
Yeah. And also, it can also be a neuromuscular control issue, which is what I commonly see in people, where it's like they might be strong, but they're just not timed right. It's like their initiation of their pelvic floor is off. We actually want it we call it like a bottoms up approach, is like close the canister from below so that a lot of times you can have an overactivation of your transversus abdominis, which we see a lot in our female athletes, where it's the one that's doing the initiation of the trunk canister control, and it's pushing on the pelvic floor even more. And that's pushing on the bladder. And then you get the leaking. The pelvic floor is like, I give up, transversus, you're winning, you know? Yeah. So then you have to just get pelvic floor to be the initiator, and it takes some learning, but totally able to do.
Oh my gosh, I have some questions. But you want to ask your questions?
Well, when I was younger, I think this is like going into like how can we, I don't know if the right word is to fix it or what we can do about it. Because I know I experienced this when I was younger, and same with like all my other teammates, but we didn't talk about it that much. It was kind of embarrassing. And then as I got older, it was still embarrassing, but it started to become a thing that we talked about and laughed about. But none of us were like, oh, like, what should we do about this? All we would do is like, oh, I gotta go to the bathroom, like, I gotta go right now. But is there anything, I know you just talked about like training it, but is that the only solution, or is there, you know, breathing techniques? Like what is that?
So the other piece of this is a hypertonic pelvic floor. So overly tight pelvic floor. It's just what really commonly see in a lot of female athletes and non-female athletes. Just really depends on the person. But a lot of times what will happen is, and I don't know if you see it, but like, so if you have a regular resting length of your pelvic floor, just like any skeletal muscle, it can be weakened and have trouble contracting. You can also have it too tight. And so we often commonly say like, okay, what if you walked around with your elbow bent, right? Your bicep on like 16 hours for that day. Then when you go to release it, it's like super weakened. So you can have an overly tight muscle and weak, which can also cause your incontinence. Because oftentimes people are like, well, I do my Kegels. 50% do them wrong, right? That's what we show in research. But you can also have too tight, because if your muscle's unable to get full excursion and lengthening, it cannot get full contraction strength. So that's where it becomes very individualized of like, do you have a more hypotonic pelvic floor or hypertonic pelvic floor? Where is it at? And then also that neuromuscular control of the coordination. So it does get into the weeds with each person, but there are commonly like kind of like go-to things. Like if you tend to have more pelvic pain, then you're probably more of a hypertonic pelvic floor. And pelvic pain is going to be pain with sex, pain with tampon insertion, pain with gynecological speculum exam, or high anxiety kind of type A stuff. So to get to your question, which I've kind of forgotten. Can you say it again? I'm so sorry.
Yeah.
Just like, I mean, you've answered it. I mean, it's just what can we do about it? Like, is there even something we can do about it?
On your own, you mean? Not with a PT, but on your own?
I mean, I guess on your own, and then to know if you need to get help from a pelvic floor specialist.
So we just came out with a study on, it was in runners with stress urinary incontinence, and this run the gamut of, didn't have to be postpartum, it's nulliparous. And yes, there is. So I'm a big proponent of this, because like people will like go and do these online programs and like they're doing it anyway. Like, let's teach them the right way. So you can, I run these general programs, and what I see is they work in a lot of people. There's always like that couple that it won't work for. And so then, doing a generalized exercise program for pelvic floor is great. The biggest thing is adding in the relaxations. So people will do their Kegels. You also have to do the relaxations of the pelvic floor. So maybe let's walk through it right now, because that'd be fun, right?
Yeah.
The whole audience is like willing to do. So if you put your hand on your chest and your hand on your belly, I'm just talking to the audience here. So if you inhale, just kind of see where your breath is. I know we all want to roll our eyes and be like, oh my God, breath work. But as you know about that canister, it's super, super important. And this is where we start off. So if you inhale, where do you inhale into? We want to direct that breath into the belly. So when people tend to breathe with their chest, I ask them to put both hands on their belly just to redirect that breath to the belly. So inhale into the belly. Of course, the air isn't going into the belly. It's just your diaphragm and then that excursion. And then exhale, let it fall. Let's try that again. Inhale into your belly. And exhale, let it fall. I know you both probably know how to do this, but it's for the audience. So then we're going to add the pelvic floor. So now, as you're sitting there, if you are a person listening, then you want to just kind of like, you are sitting on your pelvic floor between your sits bones. So there's a couple different, there's so many cues I could give. I like a couple different ones, but we'll go with like a tampon. So if you imagine there's a tampon in your vaginal canal, on inhale, let your belly get big. On exhale, I want you to squeeze the tampon and pull it up, 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 and in. And then inhale, let it all go. Good. And just take a normal breath. And then again, inhale into the belly. And exhale, squeeze the tampon and pull it up, 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 and in. And inhale, let it go. So somebody might be like, I don't feel anything. I don't know. Or I do feel it. If you do feel that, and you're also feeling your lower belly kind of hug towards your spine, that's fabulous. That means that your pelvic floor is still best friends with your transversus abdominis because they share a fascial sheath together. And so we want them to be coordinated with one another. And we want that pelvic floor to be leading the movement. So if you felt, or even if you didn't, we're going to add on to this. So if you inhale into your belly, exhale, squeeze the tampon and pull it up, 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 and in, and then pull your belly button towards your spine. And then inhale, let it go. So don't suck your belly in. It's just a gentle draw of your belly button towards your spine. So let's try that again. Inhale into your belly. Exhale, squeeze the tampon or put the person in the elevator and walk it up, 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 up towards your head. And then pull your belly button towards your spine. Inhale and let it go. So that's how to, I like to say the word engage the pelvic floor, because what I have found is when I say contract, people go crazy and they're just like, nee, and like their whole body tenses up. And I'm like, wipe that out of your brain. We're going to train this thing in our pelvic floor and our transversus in isolation, because when you might be noticing, audience out there, you might be squeezing your glutes or and so we want to be able to do this without squeezing your glutes. That's the challenge, right? So then the next piece of it is how to relax your pelvic floor, because that is just as equally important. I want to stress that it's just as equally important as contracting your pelvic floor, engaging it. So now, to confuse everybody, we're going to inhale into our belly. The nice thing is everything's on the exhalation, and then exhale. And now what I want you to think, and this is my favorite cue most of all, as you're sitting there on your bottom in between your sits bones, I want you to think warm melted cheese, like that ooey gooey cheese. And that's what your muscle is becoming between your sits bones. So you're going to inhale into your belly. Exhale, just think warm melted cheese, or a lotus flower opening up, or a rosebud opening up, because what we're not doing is bearing down. We're just giving a nice relaxation to open up your pelvic floor and let it relax. So you can do those like the engagements twice a day for 10 times. And I always have people end with their pelvic floor muscle relaxation. So do 3 of those at the end of each of those 10 reps. Just because I want people to end with a nice lengthened pelvic floor.
Nice, Jen. I have to say, though, I don't actually like the image of cheese in my pelvic floor.
Use the lotus flower, the rosebud opening, whatever works for you. Everybody's different. And I love that you say that, because it is true. Like, I don't mean to get all serious all of a sudden, but I'd say about 90% of the patients that walk through my door have a history of trauma or some kind of uncomfortable thing related to their pelvic floor disorder.
Mm-hmm.
And whether that's a history of medical trauma or abuse, it's, our country does not do sex, grief, and death well. We like to shove it under the rug and ignore it. But in pelvic health, it all comes out. And so I've literally had patients on the table where it's like, we're doing pelvic floor work. I know they have a counselor they're working with because that's like a big, big thing. And I'll like say their trigger word, like say their pelvic floor is doing great. And then I'll purposely say their trigger word. And then like, it seizes up. I'm like, all right, you know what to work on with their psychologist here. And she's like, yeah, I get it. And so really that mind body connection is really strong. So I do believe in finding that word, that cue that works for you to engage and relax your pelvic floor is super critical. So yeah.
And just to add to your the tampon analogy that you were talking about earlier, I want to be clear for the audience with that. When we were what was the word that you used? Squeezing the tampon or letting the tampon lift up, squeeze and lift up the tampon. When we were letting go, we weren't trying to like spit that tampon out. That's not the type of relaxation we were trying to do. We're trying to just kind of like release, but not like throw out.
Right. Yeah. You're not trying to push the tampon out. Yeah. No. When I do the relaxation, I often don't even say anything about, that's why I say the warm melted cheese. Cause I'm like, okay, now we're just thinking about the muscles that you're sitting on, or, when you're laying down, the muscles between your sits bones, just think of that area and let it just get relaxed. And so opening like a lotus flower on relaxation. So kind of thinking of that. Yeah. Great clarification there.
Thanks, Jen.
I have a question. Do males leak too? I mean, obviously they are in all these high impact sports as well. So I was just wondering.
Well, they have a little bit of extra like integrity to their tissues. They don't have that vaginal canal there. And so it is helping to assist with their continence. However, yes, they can. And they can get a lot of pelvic pain too. So, and like things like erectile dysfunction, and a lot of that comes down to really hypertonic pelvic floors. They can also have weaker too. So yeah, males are not, it's unavoidable here too. Like they're in it with us, and kiddos, right? So we think of kiddos and, a lot of constipation with kiddos. And so that can be treated and with like hands off kind of treatment stuff. So yeah. We're all in this together, and we all have a pelvis.
And you were talking earlier about how all like the muscles in your abdomen are just connected. You want them to be connected. So are there certain injuries that like, I guess, trigger leaking or would make it worse?
Yeah. So hip injuries are a big one. So we can even, I've had patients where it's just like, we're not going to do anything, manual on the pelvic floor. We really have to work just externally. And for a lot of like the non-internal pelvic health PTs, like they can get great results working externally. And so hip muscle, the external rotators, and the adductor muscles, they feed right into the pelvic floor. So connections through those fascial sheaths. We also see in research that when you move your arm, your pelvic floor is engaging too. So really checking somebody's strength in their arms and their legs, even in the feet. And so, I gave a talk about that. It's on my Instagram. You can go up to the little profile and listen to it, but connecting from like your foot to your head and how that's all connected to your pelvic floor. So, definitely so much we can do, just looking at, externally and injuries. So I see a lot of patients that come in that have like seen, other PTs, and it's just like, something's missing. Like I still have this chronic pain in my hamstring, or what's going on. It's often pelvic floor. And once we get that, like this is a big fascinating thing to me. I'll have patients who are like 5 out of 5 strength, highly athletic, so strong everywhere. And literally their pelvic floor is like a 0. It's like not even like barely a flicker. I'm like, girl, what is going on? Like, this is so weak. Like, this is like such a big culprit, and it's very fascinating. And once we start training that, things get a lot better.
Maybe you can explain what happens in a pelvic floor exam, or not a pelvic floor exam, but a pelvic PT appointment, because you've talked a little bit about PTs that work externally, clearly then that means that some of the PTs work internally. How do you test like pelvic floor strength? That people might be just nervous. They might have a problem and might be nervous about going to PT because they don't know who to ask about it and they don't know what that PT exam is going to be like.
Yeah, totally. And first and foremost, like, patients rule the session. So, there's often times where we will never, like I said, never do any kind of internal work. And when I say internal, I'll talk about that. But so basically what you can expect is an evaluation. And if you feel comfortable having, like, a lot of times we can just collect information by signs and symptoms. And then if we think that a pelvic floor muscle assessment is in order, we'll say, okay, are you okay with that? Like, get consent for that. And if they are, then how that works is first they will undress from bottoms down, sheet over you. We are always checking in, like, how are you feeling? Everything comfortable? And like, we want you comfortable. And so then first we'll just look at the pelvic floor and be like, okay, engage your pelvic floor and let's see what happens. And so we're just kind of trying to see, like, when you breathe, is your pelvic floor actually doing those movements on its own? And then we will palpate around and say, okay, is anything here painful? We're also looking for rashes or anything we want to tell the doctor about and be like, whoa, like, you actually have an infection going on. Like, that could be contributing to your issue. And then what we'll do is, so if there's 3 layers to your pelvic floor, and how we actually test each one is your finger. So our finger is going to be assessing, and we go to that first phalanx level, and we'll just say, okay, contract, and might palpate around. Second phalanx level, again, feeling around to see if there's any painful trigger points. You'd be amazed at how many, like, whoa, that's my hip pain. Like, I can't believe it. Like, how are you pressing on my levator ani? How is that causing my hip pain? It's like, well, it's all related, right? Like we talked about through those fascial sheaths. And then we'll go to the third layer, the third phalanx here. And that's where we run through a series of tests of your power of your pelvic floor, your endurance of your pelvic floor, and then like their fast twitch fibers. So we run you through a test like that. Then we'll assess for prolapse, and then we'll also do some more, see if there's any painful spots in there. And, often that's like a great place to start, to be like, okay, let's actually start running through some exercises here. And like, can you feel your pelvic floor engaging? Like, it's often very helpful to have somebody's tactile, which is the finger there, right, giving you instant feedback. There's also ultrasound, so biofeedback ultrasound, not diagnosing or treating with it, but it's more, so we are treating with it, but using it as biofeedback so that people can see it in real time, look at their pelvic floor and transversus to get that, like, oh, I'm doing this and that's what's happening. Like, it can be really helpful. So, and then on the other gamut, like, there's certain patients that, we just can't do that kind of work, and that's totally okay. We can do so much with clothes on, and testing your muscle strength, your hip, your arms, your transversus, and just running through that. So plenty to do.
Yeah. And then just to like add to that, there's gloves. Yeah. There's lubricant.
Oh, yeah, sorry. Thank you. Yeah.
I knew that your hands were going. I didn't want anybody to be thinking that,
Absolutely. Gloves. Oh, yes. We wash our hands and we put gloves on, and then we use lubrication. So slippery stuff is usually the clinical one. I know, oh God, I hope it didn't like horrify people. No, we definitely use gloves. Oh my gosh. And then, looking for it, like, we ask about history of STDs, anything like that, and your history of infection. And then slippery stuff is the one that's used a lot in clinic, and that's glycerin free, and it's, doesn't usually cause anybody any irritation. So yeah, thank you for saying.
And no speculum. So some people get scared of the
No. Yeah. We're not checking the uterus. We're not checking for things that, I don't go as high as the uterus, right? If there's a prolapse and the uterus is coming down to meet my finger, because that's like not where it should be, then that is. But no, we are not going to the cervix. We're not doing that. We're just purely those 24 muscles in your pelvic floor.
24.
That's
you read different resources, but that's like the biggest one.
Do you think that everyone should get like these pelvic floor exams? I feel like now that you're saying it, I feel like it would be helpful to know.
I think it'd be helpful if you have an issue, right? I mean, it's like we only do the things that we need to do, right? And if it's going to give us more information, then sure. was going to say, just mention
you might
something.
not know you have a problem. Like, we see the eye doctor when we didn't know we have an issue. We see the dentist and we didn't know we had an issue. Maybe, I don't know, maybe a pelvic floor person.
A good place to start is like, I like to give a big questionnaire to my patients before they come in. And it's like, and like, even just taking a questionnaire and being like, oh, I thought this was normal. And we always hear, right? Just because it's common doesn't make it normal. And you'd be surprised at you'd be surprised at how many things you think are normal and they are not. Like, for one, you can have a pain-free, leak-free pregnancy. You can have pain-free sex. You can have no leaking your whole life. So a lot of things have just been brushed under the rug, and I could go on and on about other things, but I won't. So I think it's a great place to start. It's just kind of taking a questionnaire and being like, oh, what are pelvic health issues, and seeing if that is. So
that's very interesting.
Thank you so much for joining us. Jen, can you tell the audience where to get a hold of you? You had mentioned like a link in your Instagram. Where can they find out more information from you and maybe contact you if they're interested in more?
Absolutely. Yeah. So I'm at Instagram at Jen_Kinder_PT. I have a Facebook page, Rehab Fitness and Wellness, also just Jen Kinder on Facebook. And then I am at the UCSF FizFit Health and Wellness Center, which is right at Mission Bay campus, right like attached to Baker Fitness Center. That's our direct access clinic. So it's like a private clinic where you come in and anyone off the street, right? It doesn't have to be a UCSF patient. And you pay out of pocket. You can submit for reimbursement to your insurance. You can use FSA and HSA. And then I'm also at the UCSF Lakeshore Clinic, which is the insurance-based clinic. So those are for that clinic's like UCSF patients that are in that system. But so plenty of options because, I'm excited to.
But what if someone's not in San Francisco? Are there pelvic floor PTs everywhere? Can they get a hold of you and get PT online? Like, how does that work?
Yeah. So, PTs in California, we lack the ability to treat across state lines. However, I can, if there's a PT in that area and they want to do telehealth, I can like consult with that. Can be a little costly though, because like if that PT wants to get paid and then they're also paying me for that consult, that can be hard on the patient. And there's also certain countries that have gone through this. There's certain countries that lack pelvic health PTs, so that's a problem. But there are definitely lots of pelvic health PTs out there. I think a great place to look is the American Physical Therapy Association. There's a directory. Herman and Wallace has a great directory, and just search it, pelvic health PT in my city, in my state, and see, because telehealth is a great option for those that maybe live a little bit farther away from a pelvic health PT. Because I think telehealth, we can do so much by telehealth, and I think it's a great option for pelvic health PT.
Thank you so much. Anything else?
Thank you.
No, I feel like I learned a lot in the past 30 minutes.
Thanks for having me. It's so fun.